Good morning, student. Let's see antidote and astringent topic which will discuss about objective type. So, first question: dash is used to counteract the poison. What are antidote poisoning? It's obviously the definition for antidote. Antidote is the answer. Second one: cyanide poisoning kit contains. There are cyanide poisoning kit. It's a composed of amyl nitrite, sodium nitrite and sodium thiosulfite. Sodium nitrite and sodium thiosulfite. Okay, so third question: cyanide poisoning has a characteristic odor of bitter and almond. What is that? Bitter and almond. Characteristic odor of cyanide poisoning, bitter and almond. Fourth question: dash therapy is used for lead poisoning. Chelate or chelate therapy or complex formation therapy is used for lead poisoning. Fifth one: chemical antidote act by change the chemical nature. So here I want to give a clear idea about there are the mechanism of action on antidote. There are three: chemical, physiological and mechanical. Chemical, physiological and mechanical. So mechanical means activated charcoal is the example. What will happen when the person consumed poison? So it will prevent the absorption of poison from the stomach. So it will absorb or it will hold the poison themselves. That mechanically how it happened, activated charcoal. And chemical, for example, sodium nitrite. So it convert the hemoglobin to methemoglobin. That is the main important comes under sodium nitrite. And physiologically how it changes the mechanism of action means, so usually in our blood in the state of ferrous state, so it convert the ferrous to ferric ion, sodium nitrate followed by sodium thiosulfate to be given to prevent the patients or to save their life. So these are the main three important mechanism of action: chemical, mechanical and physiological. So next, sixth question: activated charcoal. I already discussed activated charcoal to observe the poison. It comes under mechanical. Example for this activated charcoal, mechanical poisoning. So mechanism of action comes under mechanical. By mechanically, that means it will absorb the poisons. Okay, seventh question: dash is the example of physiological antidote. Sodium nitrate, hemoglobin, it's converting into hemoglobin to methemoglobin. So this is a ferrous state to ferric converting, that is comes under physiological. Chemical means hemoglobin to methemoglobin. Physiological means ferrous to ferric form. And activated charcoal, it comes under mechanical poisoning. And the eighth questions: what is the dash is the molecule of, it's very simple questions. Sodium Na2S2O3, Na2S2O3 and 5 molecules of water. So this is the molecular formula: Na2S2, sodium thio S2, sodium Na2S2O3, 5 molecules of water. So an important antidote in the treatment of cyanide poisoning, sodium thiosulfate. Here among all the four, so which is the ethanol, atropine, deferoxamine, so these and all not to be used, only sodium thiosulfate to be used. It will act upon chemical poisoning and mechanical physiological poisoning. It has two roles. Okay, sodium thiosulfate. In case of poisoning, activated charcoal act to reduce the absorption of substance by binding to the poison molecule. So it will hold themselves. Okay. Next, when a poison is inhaled, when method you will be thinking of to manage the case? What is the method? If the person inhaled, so we can treat them with the what is the method to be carried out means, we can treat them with two ways: thinking of active elimination of that means we have to reduce the eliminate the poison and administration of an antidote. So that is not much important. And an antidote is used to counteract the poison, which definitely you may expect to antidote important questions. You can expect the mechanism or what is the assay method. You don't forget to go through the all assay method, which already asterisk marked to be there on your syllabus, like sodium thiosulfate, copper sulfate, ammonium chloride, sodium chloride. So we already 9 important inorganic compound. You have to go through the assay method also, so remind that. So next question, which of the following antidote is not used in cyanide poisoning? Here among all those, which is not to be used as, why? Because dimercaprol we are using sodium nitrate. Dimercaprol act as a complex, it makes a complex with or bind with the poison, and sodium calcium EDT also, and sodium nitrate. So only the option might be here they are asking not used in cyanide poisoning, hydroxycobalamin. Which kind of antidote reduce the poison across the intestinal wall? Which kind of antidote reduce the poison across the intestinal walls? Means mechanical antidote, that means intestinal wall, so that it will go and bind from the wall, so it will prevent the binding of the poisons towards to wall. So okay, next, physiological antidote act by producing the effect opposite to that of action. I already told you, ferrous to converting to the ferric form, so that the poison to be prevented, absorption of poison to be prevented, so that the conversion of ferrous form to be converted into ferric form. Okay, next one, cyanide poisoning kit contains, so I already told you, so only that 3-1, but here the option is not. So if they are asking not contains, means the answer becomes C, but it contains means all should, 3 should come. Amyl nitrite, sodium nitrate and sodium thiosulfate. The question is wrong, the asking pattern is wrong. Next, how does mechanical antidote act? By preventing the absorption of poison into the body. To prevent the absorption, it's very important. Which one of the following is an example of physiological antidote? Sodium nitrite. Cyanide poisoning has a characteristic odor of bitter almond. Cyanide poisoning has a characteristic odor of bitter almond. Next we'll move on astringent chapter. An astringent, astringent means what? Protein precipitation, which strings by protein precipitation from their surface. It helps to reduce the oily skin, so that easy healing of the wounds. So here the astringent will make a protein precipitation. First answer, the astringent is a drug which shrink by protein precipitation from their surface. Also it reduces the oily nature, so nature of the surface of the skin. So it reduces, suppose if it is in oily nature, means what will happen? So that is the favorable condition to the microorganism, so it will reduces the oily skin, so that the person can get healed very fast. Next, commercially dash is used by heating. So second question, commercially dash is prepared by heating metallic zinc to bright redness in the presence of free heated air. In the presence of free heated air, that is zinc sulfate is prepared. Metallic zinc to bright redness is known as zinc sulfate. Here the main example for astringent means zinc sulfate. Zinc sulfate to be used. Example for astringent. What are definition for astringent? Definition means astringent which will produce the protein precipitate. We shrink by protein precipitate from their surface. This is a proper definition and example zinc sulfate. So how do you prepare it? Prepared by heating metallic zinc to bright redness in presence of free heated air. Okay. Third question. Dash is used in narcotic poisoning, which is also an inorganic astringent. Zinc sulfate. Yes. Astringent act as a protein precipitate. Astringent cause dash shrinkage or contractions of the tissue. So that you can get very fast heal. It will shrinkage or contraction of the tissues, so that the tissue will bind together and easily can cover their skin, so easily can get heal very fast. Okay. Alum, that like potash alum you have already prepared in that labs also. What are the two most important example for astringent? First one zinc sulfate and potash alum. Potash alum is nothing but it's a sulfate, mixture of sulfate of potassium sulfate and aluminum sulfate. It is also to be used as a astringent. Here how do you prepare? It's nothing but same questions. Alum is prepared by adding a hard concentration of alum is ammonium sulfate. Alum is prepared with that aluminum sulfate and what is it, potassium sulfate, or any two sulfate. Alum is nothing but aluminum sulfate, ammonium sulfate and potassium sulfate. Dash is to get separate out. Dash is to get aluminum sulfate. So alum is prepared by adding odd concentration of ammonium sulfate to a hard solution of aluminum sulfate. Dash is used as astringent. Zinc sulfate, you can give the two example. Why? Because they have been mentioned. Dash is used, or you can give the one example also, potash alum and zinc sulfate. So chemical formula for alum is dash, while zinc sulfate is chemical formula for alum. You can write, you everyone known about, you just listen about it. KAL, that mixture of potassium and aluminum sulfate, while zinc sulfate is an SO4. Zinc sulfate is externally used as astringent. Zinc sulfate used as an astringent. What kind of effect of astringents on tissue? What kind of, while you are astringent, if you are adding, what will happen? Like it will get shrinkage or contraction. Here the answer become B. A, that means A and answer should has to come. Okay, so next one, how do astringent act? Protein precipitate. So what is the chemical formula for alum? So this one you can write potash alum. It is the mixture of KAlSO4 twice 12 molecules of water. So what is the answer here? It has to come. That chemical formula for alum. So KAl, that means potassium aluminum sulfate, SO4 twice. Potassium KAlSO4 twice 12 molecules of water. What is the chemical formula for alum? Means KAl, potassium aluminum SO4 twice SO4 twice 12 molecules of water. Potassium aluminum sulfate, SO4 twice 12 molecules of water is the alum formula. Okay, here they are asking, you may expect one question from alum also. And zinc sulfate is also known as, so this already we discussed. Copper sulfate, blue vitriol, zinc sulfate, white vitriol, blue vitriol and white vitriol. Okay, zinc sulfate comes under white vitriol. Okay, mercuric oxide, yellow vitriol, that and all you are not at all read about. So you know white vitriol, blue vitriol is nothing but copper sulfate, and green vitriol is nothing but ferrous sulfate. And fifth one, which inorganic astringent is used in the treatment of narcotic poisoning? Zinc sulfate. So zinc sulfate is the answer. Next, zinc sulfate is prepared by the action of dash zinc oxide. Zinc sulfate is prepared, zinc sulfate. So you just remind that when zinc oxide to be treated with sulfuric acid, you will get zinc sulfate. So concentrated sulfuric acid to be treated with zinc oxide, you will get the preparation. So this is, you have read about preparation from this question. You have read about preparation also, fill ups questions. Okay. This will help you to overall understand about astringent and antidote poisoning. You can give the answer for if they asked a short answer, objective type. Okay, all the best. Thank you.